Population Services Kenya is the thought leader in social behavior change. We are aware that social behavior change is critical in any health system for any country that cares about delivering healthcare to their people. Social behavior change reduces structural barriers that hinder adoption of positive behaviors. And I must say that for PS Kenya, most of the interventions that we have supported, we have always integrated social behavior change. We know that it is very important for any country. If at all we have to achieve UHC, we have to start asking ourselves, how do people change their behaviors? Social behavior change for PS Kenya is a critical area, and in actual fact we must say that we have developed our expertise over the years to have tools that actually guide us on how to do it. We have supported the government in several health areas, including reproductive health, malaria, TB, HIV, hypertension, cervical cancer screening, and even most recently we onboarded COVID-19. And I must mention that when COVID-19 came, we quickly collaborated with the government of Kenya and other stakeholders to develop key messages for COVID prevention. And this was very important at that particular time. It was a new disease, and actually the solution was mostly to adopt healthy behaviors. We also realized that social behavior change is very critical at the community level. And when we go to implement our programs, we onboard community-based organizations. We work with CHVs, who are now called community health promoters. But we realized that they have major gaps, and we also asked ourselves, how can we do this differently? How can we build their capacity so that at any one point we don't have to gather them and train them? So in 2022 we established a grassroots network organization that was bringing together local organizations like CBOs, FBOs, and local NGOs, and we wanted to do it in a structured manner, whereby we started off by gathering information from them, what their needs are, what their strengths were, what they felt that they really needed to be supported in. And some of the things that came out were on governance, project management. SBCC, of course, was really at the middle of that. So after gathering information from them, we started off working with about 30 CBOs that were working in the various programs, and we started capacity building them, strengthening them in the gap areas that I had mentioned. That included customer service, SBCC, resource mobilization. In actual fact, most of them really talked about resource mobilization, but they are mostly needed for social behavior change communication. As an organization, we're very excited because our new strategic plan is aligned with what the government is doing. We will continue focusing on SBC. SBC will never be irrelevant. We have new generations that are coming on board. We have new diseases that are coming on board. We have new discoveries, new advancements. So at any particular point, social behavior change is needed. The other thing is that when you look at UHC, the community health promoters are being put at the center. And therefore, we are still excited as an organization because we are aligned with the government priorities, whereby we focus on SBC, we align ourselves with the CHPs, and we support the government to deliver healthcare in a sustainable manner.